Hello, this is an instructional video on how to use and then how to administer the special South Dakota Mavis version of EmpowerDB that we've built to support organizations in your state. The beginning of this video is going to just cover how to use EmpowerDB, how to use this version of the database. So if you're looking at the links of this video and you're feeling like, I don't want to watch this whole thing, it could be the case that much of this video does not apply to you. I'm just trying to show everything there is to show in just one video. You can cut out after we start getting into some of the administering stuff that might not apply to you. Okay, so this version of EmpowerDB we're making it completely free for use for forever, if that's what you would like to do. And if you just like having the same exact functionality basically as what you had in your old system, this is the kind of thing we do often in these situations. It works great for us, so just want to make sure there's no hesitation for kind of using that as a service you would like to. We're very happy to have it be a free service, but this is also being set up so that you can start using the system now so that you have something to switch over by the time that you have to switch over from Mavis. And then if you want to later, or if we are too backed up and there's not time for us, then we can kind of down the road look at expanding what you're about to see into to collect more fields and do all the other things your organization would want to know. Okay, so for now, I'm just going to show you kind of how to use this basic version of the database. So you will get a username, you will get a password, you will see this, and you'll get an address to go log into your version of EmpowerDB. Do all those things to log in, and you will get to this home screen here. Okay. The home screen for everybody we work with in EmpowerDB, we make this add activities module, and that is because adding the time spent with clients is, things done for them is the type of information that you add in the most. So we just want it right on the home page. We want to make it as easy as possible to put in. So we can just click here and type in a name and select it from the list. We can also click this drop down, and it will be show us the most 12 recent people that we provided activities to. It's assuming that you want to put in something that you did today, but if we want to switch back and say, oh, this was actually Monday, I didn't get a chance to put it in, you can switch that as well. And now we want to know what services were provided. And so here is the list of services. This list as it is now that you're seeing it is almost identical to what you had in Mavis. In Mavis, you had things like individual counseling adult, individual counseling child. We just have one for individual counseling, and the system is able to figure out who is adults and who is children through other means. Your administrator at your organization could modify this list a little bit. Even with the free version, we do allow you to modify this list quite extensively, actually. I'll show you that towards the end of the video. But you will pick out whatever you did. So maybe we did some of this, and maybe we did some of that. Okay, so all throughout the system, you're going to see these plus and minus buttons, and that just kind of lets you say more things were done. Okay, upgraded members of EmpowerDB, those who have on our paid plan, can track like the amounts, like exactly what financial assistance was given, the dollar value amounts, run queries off of that. But this simple version just kind of says, yep, that's a thing, and we have done it. Okay, EmpowerDB separates services from referrals. So we also want to say we made a referral to other services resources, and if we want, we can type in the name of whatever that other place was. This is just for our own kind of internal use. It's not used in any reports. And just like all the others, we can come in and add as many referrals as we want. And then we can enter case notes here. Okay, so whatever you feel like is appropriate to enter for case notes onto the session, add activities. Okay, we see at the top, success, activities added for that person. We can also add group activities, and this is done a little bit different than what you've done before. We click to activities for groups, and now we can select which group was done. You started off here with just one generic item for support group, but you can fill this in with all the different groups that you serve. Even on the free plan, you can fill this list in with all your different groups. And then now we're going to say, here's all the people who attended this group. Okay, I just want to mention I was given some fake data to feed into this system, and I've put fake names here. These are not real names. Okay, and then notes about the group. Okay, so you just go through, add in all the attendees. So adding in a group record is super easy because you just have to do it once per group, and you just add in all the people. If this group was basically the same group, you know, same people attended this group as one you've done recently, you can click copy from past entry. It's going to show you the recent groups that you've done, and you can say, okay, it was basically this group of people, and actually Zara wasn't there and Jessica was. Okay, we will add those in. So that's adding in the activities. Where do we go to see what we've added? Well, there's a couple places we can do that. On the top left of every page is this calendar icon. So we'll click there, and this shows us, okay. Yep, so here was April 28th that we just added this in. Here was everything we just added in for Jessica. And then here was our support group that we added in. From this view, we can also be like, oh yeah, things happened on April 29th, and click on the April 29th. And that brings up this window with that date filled in, where we can really easily type something in, enter in an activity. We can also switch this to an outline mode. And now this is a list of all the things that happened. We can say, I actually only want to see the things that happened to Jessica, or things that we did for Jessica, perhaps. And that's going to be a list of everything for Jessica. There's an easier way to get to the screen where we can see everything from this one client, and I will be sure to show you that in a little bit. Okay, so that's adding in activities. I did just want to mention, I realized you saw me enter in a service, a referral, and a note. You don't have to enter in all three of those things. You can just add a service, you can just add a referral, and you can even just add a note. So a lot of times people will want to put something like left a voicemail, you know, something like that, where it didn't really provide a service, but we still want to record that this happened for just good measure. All right, we're going to keep scrolling down, see what else is on this homepage. We've got, this is a readout showing you every month and how many activities have been entered into the system each month. And that kind of helps your supervisor know that you are putting the time into the database like you should. So your administrators will see a readout here of all users across the organization in all of the months in the past 6 months, and so that they can kind of get a quick glimpse about what's going on. Date reminders here at the bottom. Birthdays, people that you've seen recently coming up. Is that helpful? You decide. It's at the bottom. Okay, scrolling back up, we've got a random quote every time we come here. We can click this once a day and get a wacky compliment. We can change the color theme. And just, these are my kind of not actual functional parts of the database, and just more for fun things that I always show people. Coming very soon, we're going to make it so you can make your own custom color theme. That'll be great. Okay. Data completion reminders. This is a really key thing. So the database knows that we've worked with this person recently, either because we provided a service to them recently, or they are currently enrolled in a shelter or some sort of residential program, and we do not have 100% of the information that the funders need filled out for this client. So it's reminding us, hey, we got to fill in this information for this person. Okay, we do kind of say, like, if you're adding a client into the database and you don't know something, you don't know the answer to one of these questions, and you know that you will know it later, it's fine to leave it blank because the database will remind you here. Be like, hey, you said you know this later. You got to go fill that in. So it's fine to have a few names be on that list there if you know that you're going to come and find out that later. But let's say we just have, this person was supposed to come in for an appointment. They didn't show up. We have no hope that she will. So we're just going to say, okay, we don't know anymore. So we're unknown. That question has gone away from being highlighted. You'll see now that this is marked as 100% complete. I'm going to kind of show you what it looked like before I started rambling. So that now it says 94% complete. There's one missing, and we could have just clicked right on that one missing thing to get taken to that disability that's missing, save changes, and now our data completion reminders section is empty. Very powerful tool, the data completion reminders, to make sure that administrators aren't having to track down staff at the end of a reporting period to make sure the data is in as it should be. Okay, and then we've got a few links here. If you're interested in running reports, you can go to the reports section. If you're an administrator, you'll have these things, and we'll go over that towards the end of this video. Okay, so I showed you adding activities. This is adding activities for clients that are already in the database, but let's add in some clients that are not already in the database. So from the home page, we go to add new entry. It wants to know, are we adding a client survey, or some sort of event, like an outreach event? But here we're adding a client. And now it wants to know which program are we enrolling them into. Let's start off with non-shelter. This is not an anonymous client. If it was, their stuff would go away, but it is not anonymous. And then I think this was the name that matches. Okay, yep. So I've written in a name, and then notice that over on the right here, it says, hey, there's somebody in the database already who has, notice that it's not the exact name. I intentionally wrote Bella instead of Bell. It has a very similar name. Are you sure you want to be adding in a new person? And we can click on this client record, and we can look through and be like, oh yeah, they're in Rapid City, and that's their birthday, so this is the same person, and we would come back here and stop adding a new client. But maybe this is a very different person. And we'll just add in a brand new name like this. Okay, many of the fields here, this is set up to really look as close as we can get you to what you're currently doing in Mavis, so it shouldn't be that big of a shock. One thing right off the bat that's a little bit different is addresses and locations. We tend to like to say that, like, if somebody moves, it's kind of nice to know where they used to live. So if somebody currently lives in South Shore, and then later on they move, we want to be able to say include additional location, and then now they have moved to Long Valley. And the system will keep a good record and say, okay, on this date they lives here, and then on that date they moved there, and it just lets you have a better historical access to this kind of information. We can select what county they lived in. In Mavis, you had a list of counties that appeared to be for the entire country. I have broken it down into counties of South Dakota, and then counties of all your neighboring states. But if somebody happens to be from a county outside of South Dakota or your neighboring states, then you would just scroll to the very bottom and select that. When we're entering in cities, we can also just type in a city up here. So type in a street address, and then we can go, okay, is it this one? Oh yeah, they told me they live right next to Dakota Herb, I guess. So I know that's correct. I'm going to fill that in right there, and then it automatically fills in the location, the zip code, and the county, all for you. And then we can click this map later, and again, see where they live Again, I don't know anybody actually lives there. I just wrote that in randomly. Next, we have phone numbers. We can enter in somebody's mobile phone. Or we can enter in a home phone. And then in EmpowerDB, we have these safe to options: safe to call, safe to leave a message, safe to text message, to help you and other team members know which of these things are okay to do for each phone number. Okay. We've already said that we're enrolling them into the non-shelter program, but we can check off another program if we want from here. This is a question that was not in Mavis, but is being used by your funders, and so we thought to add it. This is OVW wants to know, are people fully served, partially served, or not served? If you select partially served, you check off the reasons why, and that shows up in the report. But if you just say served, then that's the end of that. Next, we have children. If we say no children, we have no other questions about children. But if we have one child, now we want to know what the name of the child, their birth date, and their gender. For non-residential clients, this entering in child information, this is mostly just helpful information to have about the child. It's good to know that this client has 2 children and what their names are, and their general ages and genders. For shelter, we're going to see how this works for shelter. What kind of weird name did I pick up here? So I'll kind of fill in some fake data here so we can see what this looks like when we get into shelter. When we're entering in birth dates or ages, if we know somebody's exact birth date, we can select it from the calendar. We don't have to select it from the calendar. If we know somebody's exact birthday, we can just come here and type it. And then the database will always know how old somebody is based off of their birth date. If you don't know their birthday at all, you can click here and say, I have no clue how old this person is, age completely unknown. Or I don't know how old they are, but they are definitely a child. Or don't know how old they are definitely an adult. Or we encourage you to make an estimate for their age. And this makes it so that no matter what funder age range brackets there are, we're always going to know where to put this person, even though we don't know their exact birth date. We could just kind of know that, yes, this person, what's 25, 59, something like that. So this person would definitely be there. And then 2 years later, if we came back, it would say they are estimate 32 years old. So the estimate does age over time. Okay, so go back to putting birthday in there. Now they're 16. And then do this. And we don't know how old they are. Okay, now we're back to filling in things about the client, the parent in the situation. Again, we can fill in their exact birth date or do that estimate age thing. Pick a gender. Race, you were previously selecting one race, but now most of your funders are asking race to be chosen in a select multiple situation. So that's why we have it like this. And similarly, you had to select one before for your disability, but it seemed like people could have more than one disability. And so that's why we've got this. And the rest of these questions, I think, are all what you're used to seeing. And then this one is new. This was added to, I think, the vocal report. No, I'm not sure now anymore. But anyways, this is added to one of those reports quite recently, so that's probably why it wasn't in your old database, but it's here now if you want to answer it. The questions highlighted in yellow are the ones that kind of the expectation is that you will know this. So anything that was in your old system, the expectation is you will keep continuing to know this. But the brand new things like this, we haven't set as expecting you to know this and contributing to the score because it's totally new. Okay, next we have incidents. In your old system, this was called client issues. It works really pretty similar. So we can say, okay, they are a primary victim. They disclosed all this to me today. Their primary victim was domestic violence. And then this is the list of abuse types that you're copied exactly from yours. But again, your old system had this as a select one, but Voca is expecting to have this be checked off multiple things. So you can check off as many items as you need to. And on here, you do have to answer primary victim and all types of victimization separately. The OVW reports want to have it categorized into this way, and Voca reports want to have it categorized in that way. We can go through here and say the relationship to offender. This is exactly as you had it before. If somebody has disclosed multiple incidents, we can say include additional incident, and then add in all the same details about that extra incident. Here are protection orders, a form for this, and this should all make sense. And again, just like before, we can include as many protection orders entries as we want by just clicking include additional order. And finally, we have add initial activities. So if you remember, we're adding a brand new client into the system now. So it's kind of giving us an opportunity to say, well, if you're adding a brand new client, you probably did some stuff with them. So here's where we can say, yep, we did individual counseling and crisis intervention. Walk-in client did blah, blah, blah. Say whatever we gotta say. Let's add that client in. Bella is added. So now no matter where we are in the database, we can come up here, start typing in a name, and go directly to this person's client record. At this client record, we can see this is their internal ID that they've been assigned. In case that's ever helpful to you, you can look up clients by ID as well. So if we just type in that number up here, we'll see them. And yeah, when we go look up a client, we see all of the fields that we just added. And we can go in here, add in new stuff if we've got new information. Save changes. It's a database. Easy. On the right, we see this all client data link. This is just going to give us the exact same list. Once we start working with some of you to expand the system to collect more things, we find that some of you, it's almost always there's like a set of data that the shelter programs need, a set of data that non-shelter programs need, and so you'll upgraded sites that we've worked with will have a much fuller list over here, kind of different intake pages for your different organizations. And then this section here, points in time, it's saying, well, we know that there's one incident. Do you want to just go straight to look at that? And we can click there. Here's that one incident. And from here, we can go add a new entry and say, okay, they've disclosed to us that they're a secondary survivor of sexual assault. Put in the information there. So this is, we're doing the exact same thing that we saw on that other screen, but it's just different people have different preferences and how they view the data and different workflows, things like that. Up here in this menu is what the industry calls breadcrumbs. So it kind of shows us a history of how deep we are in the database. We are at the home page. We are looking at non-shelter clients. We had Bella's record, and now we went straight to their incidence point in time. We can go right back to this, and now we're looking at Bella's main record. Here is that link that I told you I'd show you to go right to the view to see all the things that have been done with this client. So we click there, and now this is going to be a list of everything that was done that's been done with the client, and it'll show multiple users. If multiple staff have worked with them, it'll show that, and it'll show their names going forward, the staff names going forward. Okay, we can go back to there. Now let's say that this person has moved into the residential program, an emergency shelter. We can, this list of program names, administrators can change this list. So you might see this list be something slightly different. But let's say, okay, now they're an emergency shelter. And now that they're there, we have access to this move in and move outs point in time. So here's where we're going to say, okay, they enrolled into an emergency shelter unit as of this date, and we'll leave their move out date empty. And just like all the other ones we've done before, let's say that they were in April 1st and then out on the 12th, but then came back, we can say include additional move-in, select this again, and now say they moved in again on the 21st. Okay, we'll save those changes. Right, let's take a look at these program lists. So at the top of every page is going to be this program list view. The non-shelter program list is going to be just kind of a list of all the people that the non-shelter program has served recently. It's not always the most helpful, but the emergency shelter list and the transitional housing lists are definitely very helpful. This is going to be a list of all of the people who are currently in the residence. So if we're coming here and we know, okay, Bella, we know has moved out, so we can click her name. We can scroll down to the move in and move out section, but this could be a situation where we go, I don't want to scroll, I just want to click right here and be like, yes, they're April 21st move in. They've moved out as of today. Okay, now when we come back here, I'm going to talk to you about these children. Children in residential programs should automatically be upgrading to full client entries. So I don't know why it hasn't happened here, just some switch I didn't flip. I'm not going to re-record the video at this point. I'm talking for like a half an hour. So just know that will happen to you. If a parent is put in a residential program and they have children, these children will automatically be upgraded to what we call full client entries. Right now, this is not a full client. So if I come in here and I type in Billy, no matching entries will be found because this, what we call, is a basic child entry. And that's usually what happens for non-residential programs. If you are providing services to this child in a non-residential program, you can come in here and say, I want to modify this entry and upgrade them to a full client entry. And then now this is a full client, and we can come in here, look them up, go to their record, fill in all the data that we fill in for everybody else, add activities for them to say that we've provided direct services to them. Okay, so the children are going to need their move-in and move-out dates too, so that we can get an accurate representation of when which children were in the shelter and for how long. So if we go in here and go to their move-in and move-out section, we can add in and say, okay, this child moved in on that date. Okay, let's go back to this shelter list. Oops, it's because I moved Bella out that she's no longer showing up as a current resident, so I'm going to clear this out. From this screen, we could have also clicked copy to children, and we wouldn't have then had to go to each individual child's record. It would just automatically add this onto the child record itself. Okay, we'll go back to the emergency shelter list, current residents, and there we go. Okay, so it knows that this person moved in April 1st. Billy is moved in as of April 22nd, and we know that Rebecca exists, but she is not moved in. So if that's the case, if Rebecca really is not in the shelter, I know there's various reasons why that could be the case, then that's fine to leave it like this and have her be grayed out. But this grayed out situation is a good indicator that something needs to be added in if it's been missed. So again, it would just, in a shelter program, all the children are going to be automatically upgraded. You do not have to go, you will not have to go through this process to upgrade the child for these shelter programs. So you would just, from this page, click on this child's name and then go add in the intake information for them. That really is everything you need to know about adding in client data into the database. So I'm just going to kind of move on and assume that you've got it. Let's talk really briefly about adding in client surveys and events. These are used for various reports. I believe this is FIPSA has these surveys. This is just a really basic survey, gets you just exactly what FIPSA needs. We are very used to expanding on these questions with lots of other questions that organizations want to know internally, but this is just the bare bones, gets you what you need for your funders. And then FIPSA, I believe, is the one who looks at these events and say we did an adult general population event with 50 people, and we would add that in and look at our past events by looking in this data form section. So these entries are not client entries, they are what we separate thing that we call data forms. Okay. That is all you need to know about how to use this database. So if you are not an administrator, then you can feel free to just cut out this video now. You don't have to watch the rest. If you are an administrator, I'm going to tell you now how to load in your data from the South Dakota Mavis system, and then how to change some things, even the things that you can change on our free template. Okay, administrators will have this EmpowerDB administration link on their homepage here, and then you're going to want to look for this option, Import Mavis Data. If you've already imported some data, it's going to show you this big old warning that if you import more data, it will erase everything that you've already imported and everything that you've manually entered on your own. So really the goal here is that you're going to do this import. You're going to check that all the import things happened the way it should. Everything ended up going where it needed to. And then you should only start adding more data into the system once you're confident that you're not going to need this import tool again. So it's pretty simple. We click attach file. I'm picking this file. And we click submit. It's going to take, I said up to a minute, but I've done test runs with this fake data I received and it takes like 5 seconds. So just be a little bit patient when you submit the data and it's going to all go in. There are some things that the data import tool will not carry over from Mavis into EmpowerDB. First and foremost are these things. These things are not carrying over from Mavis to EmpowerDB because the Mavis system does not export them in the report tool. So if it's not in what gets exported, I can't import it for you. It would be very, very easy for me to change the import tool to handle importing this data. So and a lot of this stuff seems like really valuable things to know, like phone numbers. You don't want to lose everybody's phone numbers that you've been tracking. Street addresses. You don't want to lose everybody's street addresses. If anybody can get somebody at the state to modify the ADAP report page to export all of this information, it will be very, very easy for me to change this importer tool to recognize that this information exists and import it for you. Okay, so please, you can read through that. And then this is a list of things that EmpowerDB does differently than Mavis. I'm not going to go over this list now. This video is going to be long enough, but please take a moment to read through this list so you can kind of understand what might be slightly different in EmpowerDB compared to Mavis. Okay, that's the importer tool. I'm ecstatic that importing this data is going to be this easy. Let's talk about adding and editing users. So from the home page, we can go to staff list. And then because you are an administrator, you will be able to click Add New Staff or Edit a staff's record. So we can say Add New Staff, type in the staff's name, their email, the username that you want them to have, their password. By default, you will assign passwords to your staff. You can have a conversation with them to find out what password, a password that they might like. If you ask them what password they might like and they immediately tell you what sounds like a very good password, it's because they use that password everywhere, and that means it is not secure for a client management database, which means you need to tell them to come up with a new password. So get out a book, point to some random numbers, make a password like that. That's how I point to some random words and make up some random numbers, and that's kind of a good password. Permission level, most people will be standard users. Program administrators can modify client records and user records that are in their own program, and site administrators can do everything. There's no limit to the amount of program admins or site admins that you can have, but you probably don't want to make everyone a site admin because people do strange things. Okay, so you're probably doing lots of standard users. You might say this standard user should have access to non-shelter and emergency shelter. If your organization does not have transitional housing, which I suspect most of you don't, you would just not check off transitional housing for anybody, and this transitional housing program will essentially cease to exist if no one can see that it exists. And you can say, I also want them to be entering in client surveys and events. If you have no interest in using this functionality, you can just uncheck that for everybody, and again, it will cease to exist. Okay, so you would just add new staff, and you're going to go through that process for all your different staff. And your staff list will fill up with the number of users. There's no limit to the number of users you can add. There's no price differences to the number of users that you can add. Even free accounts, add in 100 people, it doesn't matter. Okay, now let's talk about what we want to do if somebody does add in a client that already existed into the system. So we'll go look at that client. I kind of took a kind of a meandering way to get there, but I can just kind of come here and look at that client as well. On the bottom right of this page, you will see a 3-dot icon. On my account, I have the whole full name of your site, but you'll just see this 3-dot icon. You're going to click there, and you've got some things you can do. You can just fully delete this person, or you can merge them. It's saying there's somebody else who has a very similar name. Do we want to merge with them? In that case, we are not doing that because that is their child. But let's say we're merging with this person. And then here we're going to pick which name we want to keep. So the first record was Bella, second record was Belle. So maybe it's actually this that we want to keep. This is because I'm currently working on a new feature here. You won't see that. Yeah, so anywhere where there's discrepancy, you've got to go through and pick which one it should be. Okay, and then at the very bottom, you would click Merge Clients, and they are all merged. Okay, the next thing I want to show you is just kind of how to run reports. From the home page, click Reports. You've got your 4 funder reports right here. If you don't have one of these funder reports, or you don't need to generate the data for one of these reports, that's fine. Just don't click it. Let's take a look at the VOCA report for January to March. These are all the clients that are new and how much of the VOCA required data is filled in, how many services were provided, how many referrals. This screen is just kind of your way to double check that that the data that you're expecting to be in is all in. And then here we have the results. So this is the format that the federal VOCA report is in. For any of these things, you can click on a number and see who makes up that number. and then we write sometimes kind of wordy explanations about how the database is generating this number, but we find it's helpful. Yeah, these are all the numbers on the VOCA report. It's unclear to me how the state is going to expect for you to submit the VOCA data to them. We're definitely open to creating other options, like we've got this export that we can, functionality that's part of the system where we can export all this information into an Excel spreadsheet. Some people use that. So we can come up with other ways that make this easier for you to submit data to the state. Oh yeah, I was going to say, we can click here. We can see the list of services that are contributing to forming this number, and so on. Okay, we'll go back, and all these, the three other reports all kind of function in near identical ways, so I won't kind of focus on that too much. You have other reporting tools available to you. Again, everything I'm showing you is possible on the free site. You can set up a query and say, I want to know the gender of people active in January, and get that information for you. I think this data set I was sent just included March, so that was foolish of me to show January. Okay, so if you have more questions, more curiosities about how to run reports, you can go to this documentation article and it'll tell you more about how that works. Okay, last few bits here. There's a few things that even free sites can do to customize your site. So we're going to go to EmpowerDB Administration, and feel free to take a look at all this stuff, but the key bits that you'll want to do are changing program names. So perhaps you have a different name than non-shelter. This is a very FIPSA guided term here. So you could click here and say, we call this our community program. And that would be just fine. But it's very important. Do not change the name of these programs until after you have imported your data. The data import tool is looking for this exact name to do certain functionality. So if you go and change the name, the data import tool will yell at you and it will have to change back. So we can change the name of these non-shelter programs. You can come in here and say, oh, we actually call this our Walnut Street shelter, something like that. Put whatever name you want in there. The last thing down here at the very bottom is this room list. By default, we're putting everybody into this one generic emergency shelter unit room, but we can instead have a non-generic thing and just be like, okay, the data that I import is going to go into this one generic room list. I don't need to change that name. I'm just making this be inactive. So no future people can be moved into that room. And then you can come through here and say, we have rooms 1, 2, 3, and overflow, like this. And now when we move people in and we go to select where they moved into, we will select from this list of 4. This does not get used for any funder. This just makes it very helpful to add people into the system and kind of see who, like, where the occupancy is, and like, it's helpful. Okay, so we can save those changes, and then those room numbers we can save for that shelter, and we can do the same for transitional housing. Transitional housing, those are more, sometimes we see those more as kind of like there's no set units. It's just kind of like we found a transitional housing space out in the community. And when that's the case, it's fine to just keep this one generic unit in there as well. Okay, the next thing I want to show you that you can change that could be really helpful is your lists of different activities. So let's start with your service types. So let's say you're coming through here, you see this list, and you're like, yeah, we would never do medical evidence collection. That's a thing that's technically on the vocal report. We would never ever do that. Click on its name, come in here, set it to not be active. And then now when we fill that in on the vocal report, now that we go in and try to add in that service, we're not going to have this in our list. Okay, the other thing that you could do is you could say, we do actually do, I'm trying to find an example, other therapy, but we're not calling it other therapy. We call it something different. You can come in here and call it something different therapy, whatever you want to call it. So that's fine. But don't come in here and be like, we never do other therapy, but we do a whole different other thing like dental exams. I don't know. You wouldn't want to ever change the name of something like this to be something completely different, because any data that was saved as this in the past, as other therapy in the past, will show up as that. And then you could also add in a brand new service type of your own and say, listen, we do this kind of, like, we have different counselings, maybe safety planning isn't in here somewhere, so we want to say that we've done safety planning, and we want that to count on the vocal report as crisis intervention, and on the stop report as that, and on this report as this, and on this report as that. Okay? So you can create your own activity types and then define how that's going to count for all of your funders. And then when you go to run each of these reports, you don't have to worry about doing any math. The database can do all the mapping out and figuring out where things should go based off of this one time where you set all of this. Yeah, that's the service types. Let's go back to administration and look at referral types. The vocal report just has these two really generic referral categories: other services, resources, other victim service programs. You can come through here, like our people we work with very often will want to fill this list up with more specific things than that. So it could be if you're referring to one specific organization quite often, and you don't want to have to type it in that in this type in box down here, or you really don't want people to type it in because you want to be able to run a good report later to say, show me the amount of people being referred to ABC org. Then you would want to add in a new referral type and say, we often refer to ABC org. And it's going to convert to VOCA as referral to other services. FIPSA just recently added this, referral to an external service. Okay, so you can fill in this referral list with as many referral items as you want. It's going to get you really good data that you'll have internally, while at the same time giving data to VOCA and FIPSA. If you add in a bunch of very specific referral items, you should come here and say, okay, now we do not need this generic thing. We still want to keep it in the system because when you import your data from Mavis, it's going to all be categorized under these generic things. But moving forward, you will have very good data for you internally and for your funders. Switch these back. Okay, and the last thing is groups. So as I showed you at the very beginning, there's support groups. There's just one generic item for a support group, but you can come here and say, we do a Wednesday Spanish support group. Fill in this item and say, yes, this is going to count for FIPSA, VOCA and FIPSA, but maybe not SASP because maybe this is a Spanish DV group, something like that. Okay, and if you do choose to fill in this list of group types with your own lists, you can take this generic one And just like we've done before, make it not active anymore so that you still have all the old data identified as that generic thing, but no future data will be added as this. Okay, that is everything that I want to show you about how to use, import your data, and administer this version of EmpowerDB. Again, everything that I've shown you is just a template that we've built meant to mirror as much as possible what the Mavis database that we've seen can do. EmpowerDB can do so much more than what I've just shown you. We can set it up to collect all different fields. You can have all different kinds of programs. You can collect much more robust surveys. You can upload files for people. You can give, attach file attachments to clients. You can just, I don't want to make this video be another 40 minutes long because I could spend that much time talking about all the different things that EmpowerDB can do. So if you're interested in having a database that can do more than what I've shown you here, get in touch with us. You can go to our homepage and click this contact button, fill in this form. We'll get back to you right away. Or perhaps you have our email address already. Feel free to reach out to us via that. And again, if all you want to do is you go try free, go to here and select the South Dakota Mavis template from that list of templates and use this database for free forever. Honestly, that's totally fine for us. We'll give you some support, like you can click here, click EmpowerDB support, ask us some questions. We just won't get on phone calls or meetings with you because kind of have to draw a line somewhere. But otherwise, we'll give you all the information you need over support messages to make sure you're able to take the most out of this platform. Okay, I hope this was helpful to you, and we're looking forward to working with more of you across the state very soon. Thanks.